Hello, welcome back. In this video we will look at insulin resistance and the 7 foods that may help you avoid this health condition. Under normal circumstances, the food you eat is broken down into glucose, which serves as your body's primary energy source. When glucose enters your bloodstream, your pancreas produces insulin. Insulin encourages glucose entry into your muscle, fat, and liver cells, allowing them to use it for energy or store it for later use. When your cells successfully absorb glucose and your blood sugar levels fall, your pancreas stops producing insulin. However, depending on a number of factors, your muscle, fat, and liver cells may respond poorly to insulin, resulting in insufficient uptake of glucose from the blood or inability to store it, resulting as insulin resistance. Changes in lifestyle, particularly dietary changes, may be beneficial in treating this condition. Here are 7 foods that can aid in the treatment of insulin resistance. But before we begin, make sure you click that subscribe button and turn on the notification bell so you never miss out on important health topics like this one. Number 1. Cinnamon. Cinnamon has insulin-like properties and may help produce the body's insulin requirements. One of the compounds found in cinnamon, methyl hydroxychalcone polymer or MHCP, has been shown to improve cellular glucose uptake and insulin response. These actions improve the cell's ability to use glucose efficiently. Cinnamon contains polyphenols, which are powerful antioxidants that can protect our bodies from damage caused by harmful substances. These antioxidants help to reduce cell stress and fight inflammation. This, in turn, can improve the function of insulin-responsive cells and increase their sensitivity to insulin. According to this study conducted in 2010, the paper suggests that cinnamon and its components may have beneficial effects on insulin sensitivity, glucose, and lipids. Another article published in the Journal of American Diabetes Association found significant improvements in blood sugar and lipid levels with the consumption of 1 to 6 grams of cinnamon daily over a period of 40 days. Having covered the use of cinnamon, let's now look at fenugreek. We must first understand beta cells before we can see how fenugreek can help with insulin resistance. Beta cells are pancreatic cells that produce and secrete insulin. Beta cells are destroyed by the body's immune system in people with type 1 diabetes, and beta cell function can be severely impaired in people with type 2 diabetes. The ability of the body to regenerate or renew these beta cells, a process known as beta cell renewal, is important for maintaining adequate insulin production. According to some studies, fenugreek may help support beta cell renewal, thereby assisting in the production of insulin. In addition to promoting beta cell renewal, fenugreek has been shown in some studies to increase insulin secretion from beta cells. Fenugreek seeds contain 30% soluble and 20% insoluble fiber and have the potential to slow the rate at which glucose is absorbed, preventing sugar from entering our bloodstream too quickly and avoiding blood sugar spikes. According to a study published in the Journal of Diabetes and Metabolic Disorders, dietary supplementation with fenugreek may help people with prediabetes avoid developing type 2 diabetes. The study discovered that taking fenugreek powder twice a day before meals was associated with a lower risk of developing this condition with no negative side effects. Now, let's shift gears and explore blueberry. Blueberries are high in antioxidants, have a low glycemic load, and contain fiber, all of which help with insulin resistance. Anthocyanins, a type of flavonoid with antioxidant properties, are abundant in blueberries. Anthocyanins are thought to improve insulin sensitivity and lower insulin resistance by lowering oxidative stress, inflammation, and improving glucose metabolism in the body's tissues. According to a study published in the Journal of Nutrition, consuming a smoothie supplemented with blueberries for 6 weeks increased insulin sensitivity in insulin-resistant individuals. Let's now move to seaweed. Seaweeds contain fibers that help slow down how quickly our bodies digest and absorb sugar, potentially preventing blood sugar spikes. They also contain fucoxanthin, which is found in brown seaweeds such as wakame and kombu. This substance aids in the movement of sugar into our cells and can slow the rate at which our bodies produce new sugar. Seaweeds are also high in antioxidants, particularly polyphenols. These antioxidants aid in the elimination of harmful substances in our bodies, known as free radicals. Too many free radicals can cause a variety of diseases, including those that make our bodies resistant to insulin or cause type 2 diabetes. Polyphenols may make our bodies more responsive to insulin by helping to balance out these free radicals. According to this study, seaweed supplementation significantly reduced blood glucose levels in type 2 diabetes patients. Eating too much seaweed may provide too much iodine. That may lead to thyroid issues such as hypothyroidism or hypothyroidism. Always keep portions in mind. Next, let's look at bitter melon. Bitter melon contains several insulin-like compounds, including keratin, vicin, and polypeptide. These compounds appear to help lower blood sugar levels by assisting glucose transport into cells, much like insulin does. It also contains AMP-activated protein kinase, also known as the metabolic master switch. AMPK improves insulin sensitivity by increasing glucose uptake into cells and decreasing glucose production in the liver. As a result, it reduces the need for high insulin levels, easing the strain on the pancreas and aiding in blood sugar regulation. Consuming too much bitter melon can cause stomach upset, diarrhea, and a dangerously low blood sugar level. With that, let's look at black radish. Chemical compounds found in black radish, such as glucosinolate and isothiocyanate, can help regulate blood sugar levels. Eating radishes also boosts the hormone adiponectin in your body. Higher levels of this hormone may aid in the prevention of insulin resistance. Black radish is also high in dietary fiber. Fiber can slow carbohydrate digestion and absorption, preventing blood sugar spikes after meals. This effect may help to improve the body's response to insulin over time. While the dietary fiber and glucosinolates in black radish can help with insulin resistance, eating too much of it can cause bloating, gas, and diarrhea, especially if your body isn't used to it. Finally, let us look at berberine. Berberine, a chemical compound in the roots, bark, stems, and leaves of several plant species, including barberry, Oregon grape, and tree turmeric, has been shown in numerous studies to lower blood sugar levels and improve insulin sensitivity. According to Dr. Elizabeth Bradley, berberine serves two important functions. It improves insulin resistance, allowing for increased glucose transport into your cells, and it influences how your cells metabolize glucose. In a research study conducted in 2019, it was concluded that patients who included berberine in their regimen had better outcomes than those who only received standard treatment. Berberine-rich plants are uncommon in a typical supermarket, so berberine is frequently consumed as a dietary supplement. That's all there is to it. We looked at 7 fantastic foods that may help your body respond better to insulin. Check with your doctor or a dietitian to make sure these foods are right for you. Please give us a thumbs up and share this video with your friends if you enjoyed it. Don't forget to subscribe and turn on the notifications for more health-related content. Also, leave a comment below and let us know what you think about insulin resistance or if there's a health topic you'd like us to cover in a future video. Thank you for watching, and we'll see you in the next video.